All right, welcome everyone to the Pelvic Health Masterclass. So I'm super excited to be presenting this. This is actually an adaptation of a masterclass or presentation that I've been presenting to universities all across the nation last year and this year. So it's been super fun. I've had the opportunity to meet a lot of really cool students that are passionate about pelvic health or pelvic health curious, or have never heard of pelvic health before. So this is going to be a little crash course in what the heck pelvic health is and why you should be extremely stoked out of your mind about it. So that is what I hope to bring tonight. Just a lot of stoke factor. That's what we're aiming for. So also, there is a little special offer at the end of this. So everyone that is joining live, everyone that's catching this on the replay, there is going to be a special offer that I've created just for you for taking the initiative, for signing up for this masterclass and wanting to change the world. So I love teaming up with individuals who are passionate about physical therapy, who want to serve their patients to the best of their ability and want to learn some skills and knowledge to help them live up to their full potential and really serve people in the way that they deserve to be served. So in appreciation of that, I would love to offer something at the end just for you guys. So we'll go ahead and get started. So welcome to Pelvic Health. This masterclass is for anyone who is curious about the world of pelvic health and wants to learn more. So if you're here, hopefully that's you. For anyone who wants to gather skills and knowledge to reach their full potential as a PT or a future PT, this was created for you. If you want to learn how to apply pelvic health concepts to help patients and clients now, this is absolutely for you. You can take all these concepts that we talk about tonight and you can apply them in the clinic tomorrow. So that is the beauty of pelvic health. It can be applied to everyone. You can apply it to yourself tonight. You can apply it to your friends and family members, and you can really start spreading this awesome message. And if you want to spread a message of hope and healing to every corner of our world, then this masterclass was created for you. This is a crash course. This is an entry-level masterclass. I do host masterclasses throughout the year. Most of them are free. So if you're interested in more masterclasses that dive in even deeper, we get into the nitty-gritty. We do a lot of interactive stuff. Our last masterclass was all about internal exams and how to do those. So if you're interested in more masterclasses, follow me. You can find me on Instagram at Your Pelvic Health Mentor. And I'll put that in the chat later today, or you can just text me, email me, anything like that. So as I mentioned, there is a special offer at the end of this masterclass. So if it's okay, if I can offer this offer at the end, if you guys don't mind, can you go into the chat and just say yes, if I can offer that special offer at the end of the masterclass? Thank you, Grace. Thank you, Chantel. Thank you, Cynthia. Perfect, perfect. Yeah, we'll do it. Spoiler alert, it's not macaroons. Ooh, okay, don't know what's happening here. Let me exit out of this real quick. What do we got going on? I'm going to bring it back up again. For some reason, my slides aren't popping up. There is a storm where I am right now, so I'm wondering if that is affecting things. Huh, weird. All right, I'm just going to take it out of big share mode. No big deal. Got to roll with it. All right, and we're back. Just a little smaller screen, but I think that'll be okay. So if you are new to the world of pelvic health, if you are just hearing about pelvic health Kickstarters, which is the world that I live in and have created, this is the roadmap right here. So where are you on the roadmap? You are right here. You are joining us at a Pelvic Health Kickstarters masterclass. And as I mentioned, I host masterclasses all throughout the year. Most of them are free. So this is a place that if you're interested in pelvic health and you just want to learn more and get a taste of what this is the perfect place to do it. And if you're interested in learning more, I'll be talking about the Pelvic Health Kickstarter Academy at the end. This is literally my baby. It's everything that I wished I would have had when I was starting out in the world of pelvic health and really wanted to learn more, wanted to find education, wanted to find access to mentorship, networking, and resources. And we'll talk a little bit about the other things up this path a little bit later. So just wanted to take a moment to introduce myself. So my name is Julia. For those of you who I have not had the pleasure of meeting and talking to one-on-one, I would love to do that. I am a doctor of physical therapy. I'm also an athletic trainer. I'm a yoga teacher. And in my line of work, I refer to myself as a women's sports med physical therapist. So my background is in sports and orthopedics, and I also have a specialty in pelvic health. So I really bridge those two worlds together. And it's not terribly hard because every client who is a pelvic health client is also a sports and ortho client. Every sports and ortho client, they all have pelvic floors, which means that they are pelvic health clients. So it's really interwoven. And no matter what population of patients you're working with, if you're really into sports ortho, then these pelvic health skills will only help you better treat those patients and clients. Because as I said, pelvic health, it is musculoskeletal. It is working with people who move, which is everyone that we work with as PTs. So I am the creator of Pelvic Health Kickstarters, and I'll tell you a little bit about how that came into being. Pelvic Health Kickstarters is everything that you saw on that roadmap. And if you're looking for a way to connect with me, there is a free Facebook group. You can find it at Pelvic Health Kickstarters. I go live in that group every Wednesday night, except for tonight because I'm here with you guys. But every night, or not every night, every Wednesday night, I go live in that group to talk about a pelvic health topic, also interview some rock stars in the field of pelvic health, and we just have a phenomenal time. I also help co-run Core 4 Momentum. This group was started with a bunch of students, at least they were students, about 3 years ago when we started this venture together. They've all graduated from PT school now, and they are all pelvic health PTs. Many of them are starting their own pelvic health practices, which is really cool to see. And I'm also a guide for a lot of them in their business development, which is a huge honor for me. But Core 4 Momentum is a group that is dedicated to educating women about their journeys into, prenatal, postpartum, motherhood, everything in between. So we talk about pelvic health issues to support women around the globe. When I'm not talking about pelvic health, which is pretty much all the time, I'm an avid traveler. I love traveling. I think traveling is a special weapon. It fosters a lot of creativity that I use in my work. It's also a great touch point for patients, because if you can connect with a patient on a place that brought you a lot of joy and passion, like that just opens people up. So I love travel, huge advocate for it. Getting out of your comfort zone at any time is always a good idea. I also enjoy rock climbing. I really got into whitewater kayaking when I moved to Chattanooga, Tennessee. So I love that. I'm always on the search for whitewater. And I'm also on the search for the perfect avocado. And I mention this in a lot of talks that I give. And it's so funny because now I have so many people that send me pictures of avocados. And they're like, is this the perfect avocado you've been searching for? And I haven't found it yet, but I feel like we're getting closer. So perfect avocado, you all probably know the one I'm talking about. It's like when you cut it down the center and you open it up and it's that beautiful green ombre effect. And you're just like, it just makes you sigh. That's what I'm looking for. So if you have an avocado and you're like, I don't know, this one looks pretty dang perfect, send me a picture. It could be what I'm searching for. And then my life would be complete. So send me your avocado pics. So my mission in life, other than searching for the perfect avocado, is to guide the next generation of pelvic health advocates, educators, and clinicians. This is really my heartbeat. It's my life mission. I believe that pelvic health care should be available to everyone in our global community. I'm extremely passionate about this. This is my vision for our world. And I believe that the best way to do that is to pour into the next generation. So to pour into you guys, make sure that you're fully supported in your journey, that you have access to education, mentorship, resources, everything that you need to succeed so that you can help others. Diving in a little deeper into my story, some of you may have heard this before, especially if you're joining from the pre-PT grind. So full disclosure, I never wanted to be a pelvic health PT. This was totally not in my plans. And it's so interesting talking with other people because I've realized that so many of us kind of had the same story where like pelvic health just kind of like snuck up on them, tapped them on the shoulder and was like, hey, are you ready for me? And they're like, oh, yeah, I love you. I didn't realize. So yeah, never wanted to be a pelvic health PT. I was sports ortho, like strictly sports ortho all the way. I grew up in physical therapy. So my mom was a physical therapist. She had her own practice about a mile down the road from where I grew up in the middle of nowhere, central Pennsylvania. For those of you in California watching, it's not like California at all. It's like Amish country. So it's just cornfields. There's more cows than people. 3 cars behind an Amish buggy is a traffic jam. So that's where I grew up. But my mom was a PT there and I grew up in her clinic. And it was just like every child's dream, just toys everywhere, like big Swiss balls, trampolines, like it was just a playground. And watching my mom work, I was like, dang, like my mom goes to work and she just plays every day. And I loved how my mom was able to connect with her patients to get them really excited about their plan of care, really invested in their health and wellness, and really into that team aspect, that client clinician relationship. I'm like, this is so cool. This is what I want to do for the rest of my life. So always knew I wanted to be a PT, but pelvic health was totally not on my radar. I'd never heard of it before. So I went to PT school. We had a 2-hour lecture and a 2-hour lab that was like an introduction to pelvic health. And it was anything but exciting. Actually, in that class, I swore that I would never do pelvic health. It was just not presented well. I think we watched a video of an internal exam and I was like, ooh, no, thank you. And then we did like this lab where we just all kind of like kegeled together. And I'm like, this is weird. I just did not understand, why this was important. My mom never practiced pelvic health, and I wanted to do what my mom did. She was basically my role model, and still is to this day. She's a huge inspiration for me. And because I'd never been exposed to pelvic health before, and now I was, and just not in a very engaging way, I was like, yeah, I'm not doing this. Other people can do this, not for me. But anyways, when I started working in physical therapy, it became very clear to me that I was missing something in my knowledge and skill set. And I started to think, oh my gosh, maybe it's pelvic health. So in certain situations where I started realizing I was missing something, the first time I started getting this realization was when I was working in Denver, Colorado. I was working exclusively with triathletes, with a fellow PT by the name of Kevin DeGroot, who was my very first mentor, and really actually saved my PT career because at that point, I had done a bunch of clinical rotations. He was one of my last clinical rotations. And I had just been spending so much time with PTs that absolutely hated their jobs and like were just so unenthusiastic about their work. They were talking about patients behind their backs. They like couldn't wait to go home every day. They were just clocking in, clocking out. And I was getting really anxious because I was like, wait, like, is this what physical therapy is? Like, I don't want to hate my life. I don't want to like go into a job where I just like can't wait to leave. Like, I want to love what I do. And I was just seeing a lot of people and interacting with a lot of people that did not love what they were doing. And I started to worry that physical therapy, the type of physical therapy that I wanted to do, that I grew up seeing my mom do, did not exist anymore. And I got really disheartened to the point where I was considering dropping out of physical therapy school in my 3rd year. Like, I'd already finished all my didactic work, but I was like, well, what's the point of graduating as a PT if I don't want to do this work? So I was really having a bit of a existential crisis. And then I met Kevin, and he kind of changed everything for me because he was doing things differently. He was doing things the way that my mom did things. He was passionate about what he was doing. And he was like, hey, this version of PT, it's not dead. We're still here. You just have to be really brave and go against the grain. And I was like, all right, I can do that. So Kevin sort of saved my career before it even began. But anyways, while I was working with Kevin, we were working primarily with triathletes, which was super fun. And I realized that we were able to take these athletes to about 90–95%. And then we were hitting a wall. And I couldn't figure out like what we were missing. I felt like we were looking at everything that I'd ever been trained to assess, that Kevin had been trained to assess, and we were just missing something. I couldn't figure out what it was. It was just this nagging feeling that there was a gap in my knowledge and skill set that I could not shake. And then I started working in New Mexico, in Albuquerque at a Trauma One center, working with individuals who had experienced spinal cord injuries. And again, pelvic health kind of snuck up on me because I saw all these individuals who had experienced spinal cord injuries. And the first thing that they did in rehab, they were like, we need to get bowel and bladder back as much as we can, because that will give these individuals back their independence. Whether they will be able to walk or not in the future, we don't know yet. But if we can get them back their bladder and bowel function, we will be able to give them more autonomy and more control over their lives. We will give them confidence. We will give them power. We will give them hope. And I was like, wow, like this is pelvic floor stuff. And this is super powerful because we're offering people hope. And hope is one of the most powerful things in the universe. I was like, all right, pelvic health, like I see you. I then moved to Chattanooga, Tennessee, started working in a large corporate practice. It was a very toxic work environment for a number of reasons. One being that there was an ongoing lawsuit when I arrived, so it had nothing to do with me, but I was kind of thrown into that, and I was like, wow, this is not fun. I had a lot of anxiety because of things that were happening, and colleague relationships. It was pretty much on the fringe due to this lawsuit. Also, I was being asked to see patients and clients in a way that I did not feel comfortable with. I was being asked to see 3 to 4 patients every hour at the same time. And it got to the point where I got in trouble a few times because I was telling patients like, hey, you're the consumer. You choose and advocate for your care. I'm seeing 3 other people at the same time other than you. And I have 2 hands. So it is impossible for me to give you the care that I believe you deserve. My question is, what do you believe you deserve? Because if you believe that you deserve better than you are being offered right now, you have every right. And in fact, you have every priority to invest in yourself and go somewhere else. And that's not really what employers want their employees to tell patients. So yeah, got into a little bit of trouble, but I feel like it was totally justified. It got to the point working at this corporate clinic where my health started to suffer because I felt so misaligned with my values. I felt so misaligned with my potential. I felt like I wasn't reaching into my full potential. I felt that I wasn't able to care for people in a way that I thought that they deserved to be cared for. And it just made me feel so terrible inside that it made me sick, physically ill. And then all of a sudden, my health was suffering and I did not know how to get better. And I determined the only way to save my life, essentially, was to quit that job and go somewhere else. So I tried to go somewhere else. I applied to every private practice in the greater Chattanooga area. No one was hiring at the time. So out of desperation, I was just like, all right, well, I guess I'm starting my own practice. My mom did it. I can do it. No big deal. So yeah, I committed to starting my own practice. And as I was looking around at my community in Chattanooga, I was like, cool, like what does the community need? Where can I fill a gap? Where can I fill a need? And it became so apparent to me that Chattanooga needed pelvic health. There were no pelvic health PTs there. There were tons of moms, no pelvic health care. And I was like, all right, cool. Pelvic health is totally needed. I don't think I'm the person for the job. But I was feeling so desperate to get out of my current situation and restore my health and wellness and treat patients the way that I desperately desired to, that I was like, all right, well, if this is my ticket out, I'm going to give it, my full attention. I'm going to dive in deep, see what this is really about, and see if it is a way for me. So I started diving into the world of pelvic health, reading as many blogs as I could, listening to the few podcasts that existed at the time. Now there's tons, which is awesome. Reading all the books I could get my hands on. And when I dove in deep to pelvic health, I fell head over heels in love with it. I realized that it was this gap in my knowledge and skill base that I knew existed that I didn't know how to label. The answer that I had been looking for so long was pelvic health. And after I started realizing this, I started applying these concepts to the patients that I was treating in this corporate clinic, and they were getting better faster. Their lives are being transformed in ways that I had never experienced patients' lives being transformed. I was like, this is magical. And I never looked back after that. So a little bit about pelvic health. I'm going to try and blow this up again and see if it works now. I think just those few slides were a little glitchy. Cool. All right. So now we can see it a little better. So pelvic health is way more than just a subspecialty of physical therapy. It is literally a movement. It is a movement that is sweeping our globe. It's sweeping our nation. And it is so important. It is so needed. We need more pelvic health advocates, educators, and clinicians. We really need you. If you are interested in changing the world and being a bearer of a message of hope and healing, then we need you. Consider learning about pelvic health and applying it in some way. So just looking at the numbers, if we want to look at some quantifiable evidence of why pelvic health is so needed, here are the numbers. All these numbers are from the National Institute of Health. So NIH says that nearly 24% of women in the US are affected with one or more pelvic floor dysfunctions. I feel that this number is extremely low because the reality is that a lot of these pelvic floor dysfunctions are not being reported. And the reason they're not being reported is because individuals are suffering in silence. They don't know who they can go to talk about pain and dysfunction that's going on down there. There are so many taboos and stigmas surrounding the pelvis and the pelvic floor that people just aren't talking about it. Things are starting to change, but for a very, very long time, most of our history as humans, this stuff was not being discussed. In fact, there are so many doctors, physicians, providers who don't know how to talk about pelvic health with their patients. They're not asking questions like, hey, are you having pain with sex? Hey, are you having urine leakage with running and physical activity and things that you love doing? Hey, like, are you experiencing low back pain, pelvic pain, SI pain? None of this is being talked about. Or like, hey, you just had a baby. How's your body feel? No one's asking these questions. And because of that, if we're not asking the questions, we're not opening up the floor for people to really talk about their experience. They need an invitation in to talk about what is happening, what is going on down there, because it's so important. Urinary incontinence, so urine leakage, affects 25 million Americans. 25 million Americans, that's insane. That means as we are talking right now, 25 million Americans are actively peeing their pants. And that is insane because there is no reason why any of these individuals need to be peeing their pants unless they have a severe neurological disorder and zero control over their bladder. If it's musculoskeletal, there is no reason why urinary incontinence should be a part of their story. And as pelvic health PTs or as PTs who understand pelvic health concepts, we can help people change their stories and find freedom and hope and healing. 200 million individuals worldwide are experiencing urinary incontinence. We can change the world. That's why this is a movement. It's estimated that 50% of women experience some degree of pelvic organ prolapse in their lifetime. I also think this number is pretty incorrect just because of things that go unreported. So pelvic organ prolapse is when the organs in your abdominal cavity, so like your bladder, your uterus, your rectum, they start to descend into the pelvic bowl. And in some severe cases, start to come through the orifices or the holes in the bottom of the pelvis. So that is not a good thing. That can be very uncomfortable. That can lead to a lot of dysfunction, a lot of bladder and bowel dysfunction, and can make physical activity completely unbearable. Also can make sex really uncomfortable. So no one wants to experience this. No one really has to experience this if we have the skills and knowledge that pelvic health provides in order to help these people. It's estimated that 15% of women of childbearing age in the US report chronic pelvic pain lasting at least 6 months. Worldwide, the rate of chronic pelvic pain in women is 32%. So think about this for a moment. Chronic pelvic pain. So chronic pain is defined as pain that lasts 3 months or more. So think about being in pain every single minute of every day for 3 months. Think about being in pain for 6 months. Think about how debilitating that is, how it will change your personality, how it will change how you see yourself as a person, how you treat yourself, and then also how you treat those around you, people that you love, how you show up for yourself, how you show up for others, how you show up for your work. It affects every aspect of your life. If we can help individuals heal from this chronic pain, we can literally change their life, and we can create this ripple effect that pours into the lives of those that they love, that they come into contact with. We can change so much. 70 to 80% of the global population experiences low back pain during their lifetime. And this is one of the studies that I came across when I first started exploring pelvic health and wondering, like, I don't know, is there any validity to this? Like, is pelvic health cool? And I saw this study where it determined that 95% of women who have low back pain also have pelvic floor dysfunction. And this blew my mind, 95%. I started thinking about all the individuals in my career as a PT that had come into the clinic with low back pain and who I had treated. And I started thinking about how many of these patients had I looked at their pelvic floor. And the answer was 0, because I knew nothing about pelvic health. I knew nothing about the pelvic floor. I had no idea that it had any relationship to the low back. I had no idea that I should be assessing it for these individuals. I knew nothing. And when I saw this study, it made me feel really sad, because I was like, wow, like I have done my patients and clients a huge disservice because I didn't know to look at their pelvic floor. No one had told me that this was important. And I was just thinking about all of those cases that I could have done so much more. So big takeaway from this slide is that pelvic health, it is more than a subspecialty. It is a movement. Everyone is welcome into it. You do not have to be a pelvic health PT. Just knowing these skills, knowing this knowledge, you can open up conversations to allow people to talk about things that perhaps they've been scared to talk about. You can encourage them to seek help. You can advocate for increased access to pelvic health care in our local and global communities. You can literally change the world with this knowledge and information. You can change lives. You could change your life. So it's time to change the world. A lot of things need to change. And that's why I'm super passionate about introducing pelvic health to as many people as possible. For far too long, millions of people in our global community have been suffering in silence with pelvic health dysfunctions. Taboos need to be broken, whether they are social taboos, religious taboos, cultural taboos, they all need to be broken down. This needs to be talked about. We need to open up the conversation. Our healthcare system needs to rise to the call. In France, every person who gives birth in France, before they leave the hospital, they are handed a script for pelvic floor rehab. France is leading the charge on this. In the United States, women are searching far and wide for anyone to help support them postpartum. We are not supporting our new moms. We are not supporting our new parents. We need to do better. Our healthcare system needs to do better. Pelvic health language and conversations need to be normalized. We need to open up the conversation so people can talk about their experiences. More research needs to be devoted to pelvic health topics and concerns. If you saw that list from the NIH that we looked at on the last slide, a lot of that research was based on women. So it's very women oriented. And this is fine because usually in research, women are left out. So this is nice for a change, but the issue is that pelvic health dysfunction, these are not women's issues. These are human issues. Everyone is affected by pelvic health dysfunctions, whether you are a man, whether you are a woman, whether you are non-binary, whether you are in the LGBTQ+ community, whether you are a child, whether you are an older adult, whether you are an athlete, whether you are a couch potato surfer, I don't know, whoever you are, if you move even slightly and have a pelvic floor, if you are part of the human race, then this is important to you. And you need to be represented in the research. So right now, currently, there is a huge lack of research in pelvic health. And that is mainly because pelvic health came to our country, came to the United States a little less than 15 years ago. So like there's tons of research supporting orthopedics and sports med. There's not as much supporting pelvic health. And that's just because it's a newer field of study, which means that there's this huge window of opportunity for anyone who may be watching this. If you're interested in doing some amazing research in the field and making sure that everyone, every population is represented in the research, then this is a huge window of opportunity to do that. You can literally change the world just by researching, just by making sure that everyone is invited to the table and represented in the research. Access to pelvic health support and care needs to be spread to every corner of our globe. Some of you may know that most of my family is from the island country of Cyprus, which is between Greece and Turkey. And in the country of Cyprus, there is zero access to pelvic health services. In fact, I've had many conversations with family members in Cyprus over Zoom, just like this. And those conversations have consisted of them weeping and telling me how grateful they are to know me, that I am in the United States, that I had access to pelvic health education, and that they can come to me and tell me about their experiences and feel supported in their journey, because there is no one in their entire country who they can talk to about what they are experiencing. They have no one to talk to about their urine leakage. They have no one to talk to about their pelvic organ prolapse or their diastasis recti, which is an abdominal hernia, usually after pregnancy. They have no one to talk to about pain they're experiencing with sex. They have no one to talk to about this chronic low back pain or pelvic pain that they've been to multiple providers to help find the driver of this pain, and no one can find it. They have no one to talk to. So that's why a little personal, why for me is that I want my family, my global family, I want my brothers and sisters all around the globe to have access to care, because they deserve it. So here are some fast facts about pelvic health PTs. So a pelvic health PT is a PT who has additional training in regards to the pelvis, pelvic floor, and the core system. So you do not have to have a specialty in pelvic health to practice pelvic health, which is awesome. You could all practice pelvic health no matter what setting you're working in or what patient population you're passionate about. So pelvic health PTs are very team-oriented, which I love. So they work in teams and engage in interdisciplinary communication with specialized physicians such as OB-GYNs, midwives, doulas, sex therapists, counselors, fitness professionals, lactation consultants, nutritionists, and chiropractors. And the reason I really encourage anyone who's interested in physical therapy and especially pelvic health to connect with other professions that work with a similar population is because when you're working with someone, you want to make sure that they feel fully supported in their journey. And you got to know where your edges are as a clinician. So for me personally, I know where my edges are. Like I can give some general advice on nutrition, but if I'm working with a client who's experiencing PCOS or endometriosis, I am definitely not going to be able to provide them the education that they need on changing their diet. That is not me. I have a friend that I can refer them to who can be a part of their team and join us in this journey that we're moving forward together, who can provide them with all that support and all that information to a much, much, much greater degree than I could ever. So that's why having an interdisciplinary team is so important, because for most of these individuals that you will meet who've struggled with pelvic health dysfunction for so long, they haven't felt supported in their journey. And if you can form a team around them or a tribe around them who wants to help them and can provide all of these resources and can speak into their life, that is just going to be the most amazing experience for them. All of a sudden, they will feel seen and heard and understood. And I believe that that is the deepest of all human desires. So treatment styles, there is this what's the word I'm looking for? I guess I'll just say myth. There's this myth that if you are a pelvic health PT, you're doing internal exams all the time. You are like, you know, elbow deep in vaginas and rectums, and that is your life. It could be a part of your life, sure, but it is not like the crux of pelvic health PT at all. I spend very limited time in people's vaginas, in case you were curious. So there is an internal exam portion that is offered to patients and clients. It's never pushed, it's never forced. You can get a lot of really great information from an internal assessment. And that is why I prefer it, because it's hard to assess what's going on with muscles and structures if you are not getting your hands on them. As PTs, we sense so much through our hands, our palpation. We can assess strength, power, endurance, muscle tone, and that really helps us find our path and our plan of care for our patients. So I'm a huge advocate for internal exams if they are warranted, but they're not necessary. And there's a lot of situations where performing an internal exam may not be the best course of action for a patient, especially, if they are survivors of sexual assault or abuse. And doing internal work would create a trigger in their body. And instead of their body relaxing and sinking into the parasympathetic state where healing can occur, it just heightens their guarding. It heightens that sympathetic fight, flight, freeze state. And healing is not possible when we are in a state of agitation and stress. It's just not possible. So in situations like that, external exams are great. You can learn a lot from seeing how people move, by how they manipulate loads, by seeing the muscles that connect to the pelvis, such as the glutes and the adductors, all those big muscle groups, how they are interacting with each other. So just a little myth there. If you're interested in learning more about internal exams, I do have a masterclass on that. So watch my Instagram if you're interested in knowing when that is. The riches are in the niches. This is a fun little phrase that I learned in my business classes. So pelvic health is pretty broad. So there are pelvic health PTs that only work with men, that only work prenatal postpartum, that only work with children. So it's really possible, like if you are really in love with working with a certain population, you can work with that population and you can provide them pelvic health services, maybe on top of what you're already providing them. So there's lots of diversity within pelvic health itself. Pelvic health is really an umbrella with all these fun little things that fall underneath it. What about workplace settings? Where do we hang out? Where do we work? So all sorts of places, you name it, we're there. So private outpatient clinics, hospitals, nursing homes, gyms and sports med centers, and even clients' homes. So for the first 2 years of my practice, I was in clients' homes. I was doing postpartum care for women who had just had babies. So after their 6-week checkup, I would come into their home, I would set up my table in their living room, kitchen, poolside, whatever they wanted. And we would work on restoring their brain-body connection, strengthening their pelvic floor, getting their core system back online. And we'll talk a little bit about what all this means in a second. I don't do in-home care as much anymore. If you're wondering what I do other than this, I'm actually in the process of remodeling a house that I bought in Bethlehem. And I'm remodeling the first floor into a physical therapy clinic space. It's actually set to be done the end of this month, which is super exciting. So I will have a space and I'm looking to form a team within this space to be a one-stop shop for anyone who is seeking hope and healing. I'm also building a music venue in my backyard. So it's kind of like, I love music. I'm very involved in the music scene, and I believe that music is a healing modality. I also think that this could be a huge marketing tool to break down some taboos. I'm hoping that the community will come out to hear some local musicians. I can hand them some bladder irritants, such as alcohol, free beers, and then I can talk to them about their pelvic health and be like, hey, you came for the music, stay for the pelvic health PT. So I'll let y'all know how that goes. I think it'll go really well. So here's some fast facts about pelvic health PTs. Who do we treat? Answer is everyone. Everyone who moves and has a pelvic floor, we treat them. You can see the long list of diagnoses that we treat. Diagnoses are just labels that we give people to talk about them in the medical community. When I'm working with patients and clients, I do not give them a diagnosis. I do not give them a label. I just say, hey, your body is giving you some messages. It needs some help. There's some things out of balance. Let's focus on interpreting those messages and giving your body what it needs. That's all it is. So you can see this long list here, everything from pelvic pain, dyspareunia. Dyspareunia is a fancy word for pain with sex. So if you're playing hangman with your friends after this, use that word. They probably won't guess it. Vaginismus is pain with penetration. So it could be penetration with a tampon or a menstrual cup, could be partner penetration, could be toys, anything like that. That's another good hangman word. Could be urinary or fecal leakage, diastasis recti, which is the herniation of the abs, infertility, endometriosis, C-section recovery, IBS, healing after sexual abuse, rape, trauma, postpartum recovery, and athletic performance. For men, pelvic pain, prostatitis, tailbone pain, bladder pain, erectile dysfunction, the list goes on. Pudendal neuralgia, usually a lot of cyclists experience this. The pudendal nerve is the nerve that gives sensory information for the perineum, which is the outside of the pelvic floor area. So it's the area that you can see. And if that nerve gets compressed and irritated, you'll experience something called pudendal neuralgia. Children can experience urine leakage, which we call enuresis, or bedwetting, which we call nocturnal enuresis. So all sorts of things. Pediatric pelvic health PT is a new growing field. If you love working with children, this is an amazing field to get into. You can do so much good. And it's really impressive how pelvic health PTs who work with children engage children in loving and understanding their bodies. It's very cool. So the takeaway from this slide is, if you move and have a pelvic floor, pelvic health is important for you. So that's the message. All right, so we have a decision to make here. Would you like to step into the amazing world of pelvic health? Would you like to see what this is all about from an anatomy and physiology standpoint? If you would like to, go ahead and go into the chat and just say yes. Ooh, Grace, right on it. Yes, give me more. Cynthia, yes. Chantel, yes. Awesome. All right, I'll do it. Let's dive in. All right, first question. What is the pelvic floor? Great question. Let's answer this. So, fast facts. Pelvic floor. I'll just pull out my model. If you're a pelvic health PT, it's a rule of thumb. You always need to have a pelvic model within reaching distance. So no matter where you are, you got to be able to reach for that pelvic model, and it can be in your hands. You never know when you're going to need it. Just kidding, but not. Anyway, so this is your pelvis. This is actually a female pelvis. If we flip it over on the bottom of the pelvis, everything you see in red here is the pelvic floor. So the pelvic floor is a hammock of muscle. In the front, it attaches to the pubic symphysis, and it goes all the way to the back and encompasses the tailbone. So you can see the tailbone right here. The tailbone is fully encompassed by the pelvic floor. So if you are working with future patients, clients, current future patients or clients who are having a lot of tailbone pain and you're not looking at their pelvic floor, you really should, because if the pelvic floor is really tight, then it's not going to allow the tailbone to move. If the tailbone cannot move, we're going to have pain and dysfunction. And if we cannot get mobility from the tailbone, the body is going to try to get mobility from somewhere else. And most likely it's going to try to get mobility from somewhere higher up the spine. And if we are looking for mobility in a place where we need more stability, we're going to have pain and dysfunction. So look at the pelvic floor. The pelvic floor also extends out to the sides to your sits bones or your ischial tuberosities, the bones that you sit on. So it's this whole hammock of muscle. There are 3 layers of the pelvic floor with individual muscles in each layer. So muscle layers 1 and 2, we can refer to these as the squeezer muscles. They are the muscles that squeeze around all these holes in the bottom of the pelvis. So because this is a female pelvis, the holes on the bottom are the urethra, the vagina, and the rectum. For men, obviously, they only have 2 holes, so y'all can guess which one they do not have. So anyways, layers 1 and 2 are the squeezers. So they squeeze and create this sphincteric effect around the holes on the bottom of the pelvis to ensure that poop, pee, gas are not leaving our body until we deem that it is socially acceptable to do so. So this is great for creating friends and lasting relationships, great for social situations. The deepest layer of the pelvic floor, we can actually look inside the pelvis to see this one. The deepest layer of the pelvic floor, we can refer to this as the supporter muscles. So these are the muscles that support all of the abdominal organs. All those visceral organs are in there, and they are supported by the pelvic floor. So it creates this bowl on the bottom of the pelvis. It's highly vascularized, which means there's a ton of blood flow coming to these muscles, and it's highly innervated. So if you can see the squiggly yellow lines here, this is actually a depiction of the pudendal nerve that we mentioned before. The pudendal nerve, it follows a very tortuous path. It goes everywhere. It's kind of like the road system in Pittsburgh, if you've ever been there. I know you're all from California who are joining live, but Pittsburgh, their road systems, no rhyme or reason. It's like on ramps on top of like off ramps on top of bridges. Pittsburgh actually has more bridges than Venice. I almost forgot that place, and I haven't traveled in so long. Pittsburgh has more bridges than Venice. So there's a lot of roads going on. It's very convoluted. The pudendal nerve is more convoluted, more twisty-turny, more tortuous in its path than Pittsburgh. It goes everywhere. So because of that, it can get irritated, it can get compressed in many different areas. And that's why pudendal neuralgia can be a thing. Basic things to know about the pelvic floor. We all have one. Everyone has one. Both men and women have a pelvic floor. No matter who you are, you got one of these. So it's good to know about it. What does the pelvic floor do? Great question. So easy way to remember what the pelvic floor does, and it does a lot, is you can think of the 5 S's of pelvic floor function. So these S's are support. The pelvic floor is responsible for supporting all of the abdominal organs in the pelvic bowl. We already mentioned that. These organs include the bladder, the rectum, and the uterus. It's also responsible for sphincteric action. We've already talked about this too. So it acts as a sphincter to make sure that urine, gas, and feces only leaves your body when you deem that it is a-okay to do so. Stabilization. This is huge for anyone who moves. So the pelvic floor helps to stabilize the spine and the pelvis to deter dysfunctional movement patterns. If we don't have stabilization, as I mentioned before, we're going to try and find stabilization somewhere else, and that's going to lead to dysfunction, compensations, and pain. It also acts as a sump pump. So for those of you in pre-PT who are taking like anatomy classes, or anyone who's in PT school, you've probably heard of the term sump pump. And usually it refers to our gastroc muscles in our lower legs, because they act as sump pumps to push blood back through venous supply back up to the heart. The pelvic floor is a huge sump pump. So it does kind of the same action. It pumps blood and lymph back towards the heart so that it doesn't pool in the lower body. So this is great for detoxing. Obviously, all that lymph, we want to get it, circulating through the body. We don't want toxins to pool in the body. Sex, everyone's favorite S word. So pelvic floor function, the pelvic floor makes sex sexier. And by sex, we're talking about the respectful, mutually consenting kind all the time. So these are the 5 S's. And then we got to throw in 2 other functions of the pelvic floor. And these 2 functions, if you are practicing pelvic health in some way, these are the first 2 things you're going to tackle with all of your patients. So if you don't remember anything from this little conversation that we're having, remember this: posture and breathing. Posture and breathing are 2 huge things that if you tackle these things, you will do everyone a load of good, and you will be an exceptional pelvic health provider. So we'll talk about why posture and breathing are so important in a second, but I spend most of my time teaching individuals how to breathe and how to stand. It's really crazy. You know, you'd think that we'd be really great at breathing because like we enter the world and it's one of the first things that we do, but really we all kind of suck at it because we're spending our entire days sitting hunched over. Our lung capacity is being contracted and decreased. Everything is hunching forward. It's just nothing is open. And we're really putting our deep core system in a position that it cannot work optimally. What is the deep core system? Oh, glad you asked. Great. Perfect. We'll talk about that. So the deep core system, this is incredibly important to pelvic health. This is the system that we are tackling. So when we talk about the deep core system, we're talking about this cylinder of muscle in the midsection of the body. So on the floor of this canister, we have the pelvic floor. Makes sense. On the top of this canister, we have the breathing diaphragm. On the sides, wrapping around to the front, we have the transversus abdominis, which is your deepest abdominal muscle in the human body. It's the corset or the weight belt of the body. If you see powerlifters in competition or at the gym wearing these fancy weight belts, they're essentially wearing these belts to mimic the action of the transversus abdominis. If they were to train their transversus abdominis and engage in some good pelvic health habits, they may not need to wear that belt. Just saying. Also, on the back of this canister, we have the multifidi muscles. These muscles get ignored far too often. They deserve a spotlight. These are little muscles that go up and down between the vertebrae of the spine. So this is your canister of muscle. This is the system where human movement originates from. How cool is that? One of the things that really blew my mind when I was exploring pelvic health and wondering whether there was any validity to this field or if it was worth getting into, one of the things that really blew my mind is realizing that this right here, this picture, what you're looking at, this is the seat of all human movement. This is the place that movement is created in and supported by. And it's interesting, a soapbox that I love to jump up on all the time is this. So physical therapists are defined by our governing association, by the APTA, as experts in human movement. When I was in PT school, I did not learn about this system that is the seat of human movement. I did not learn about this system that is the origin of human movement. So when I graduated, I was referred to as an expert in human movement, but I had no idea where human movement actually originated from. Now I do. So now I don't mind calling myself an expert in human movement because I know I am. But up until I understood this system, I was only an expert in human movement by word. I was not in practice. And that is why pelvic health is so important. If you are working with athletes, targeting this system will increase their PRs. It will. It just will. If they are better able to use this system, they will be better able to move. They will have fluidity of movement. They will not have compensations. They will be pain-free. The answer is right here, or at least part of the answer, a large part of the answer. But anyways, so how does this system work? Well, let's talk about it. So when you breathe in, so everyone take an inhale. When you breathe in, let me tell you what happened in your body. So when you breathe in, your diaphragm descended to allow that air to enter your body. The diaphragm is on stretch. Your pelvic floor lengthened and elongated to allow that air to come into your pelvic bowl. Your pelvic floor is on stretch. Your transversus abdominis expanded. Your belly moved away from your spine. Your transversus abdominis is on stretch. Your multifidi muscles expanded to allow that air to move in 360 degrees around your lung field. Your multifidi muscles are on stretch. So all of a sudden we have an entire system that is on stretch. When we have muscles that are on stretch, we have potential energy. We have energy that we can do something with. So let's do something with it. Take an inhale in and then exhale. When you exhale, Your diaphragm goes back to its resting position in the rib cage. Your pelvic floor contracts and rises up towards the crown of the head. This is a Kegel contraction. Your transverse abdominis sinks back in towards your spine. Your multifidi muscles go back to their resting position. All of a sudden, we have this huge elastic recoil effect throughout this system. We have kinetic energy, we have potential energy turning into kinetic, creating this elastic recoil that creates stabilization within the pelvis and the low spine. All of a sudden, we have stability from which to move from. And the body does this automatically, or at least it should. Sometimes when there's pelvic floor dysfunction or the body experiences trauma, this normal process can get shut down. So anyways, the body is constantly doing this. It's creating this elastic recoil effect and supporting all of this movement. The body's so good at doing it that it does this in anticipation of every human movement. So before I reach for my tea, my pelvic floor in the deep core system has already activated in anticipation of that movement. Before I take a step, whether I'm walking or running, my pelvic floor muscles, they were the very first group of muscles to engage in order to support that movement. This system is so important. It's also our pressure management system. So if I'm lifting something, all that pressure, all that load is going through my body and it is being dissipated within my deep core system. When I'm walking or running, those ground reaction forces through my feet are traveling up my legs, into my body, into my pelvis, and that load, that force is being dissipated by this system. If there are kinks in the system, if the system isn't being utilized properly, if there's weakness in the system, if there's dysfunction in the system, then this load and this pressure, it's going to find the path of least resistance. It's going to find the weakness in the system and it's going to press against it. And that is where dysfunction occurs. So if the weakness in the system is in the abdomen around the linea alba, so that connective tissue line where your six-pack muscles, your rectus abdominis sew into, if it's there, then that pressure is going to push against your linea alba and you might get something called diastasis recti. If the weakness, if the break in this system is in your pelvic floor, you might experience urinary leakage or pelvic organ prolapse. If the weakness in the system is somewhere within the low back, you're going to experience low back pain. These are all diagnoses. They're just labels, but they are literally just talking about a breakdown in the system. The system isn't functioning optimally. And that is all dysfunction is. That is all these diagnoses are. It's just talking about a break in the system, a glitch in the system. So you might have realized when we talked about this system, it all started with the breath. The breath is the key in the ignition that fires up the entire deep core system. And we need all the muscles in the core system to be strong in their own right and also able to coordinate. So we need all the muscles to show up to the party and dance with each other. So we need these things. And as I mentioned before, all these muscles, this entire system, it acts in anticipation of every single movement you do. It's all activated by the breath. That's why the breath is so important. That's why it's so important as PTs that we teach our patients and clients how to breathe. And also, in order to activate this system in a healthy way, we need to make sure there's no kinks in the system. So if you have really bad posture, you're going to have muscles that are out of balance with each other. We know that muscles work best when they're at their midline. So the muscles of the core system, when they're at their midline, it means that our rib cage is stacked over our pelvic bowl, which means that our diaphragm is stacked right on top of our pelvic floor. This is a linear system. The muscles are at mid-range and they can work optimally. If we have terrible posture, there's going to be a kink in the system, which means that we're not even giving these muscles a chance to activate in the way that they are designed to. So posture, breathing, look at it in all of your patients and clients. If you do that, you're using pelvic health concepts and you're using it in a really powerful way. So takeaway from this entire discussion that we shared in together, the takeaway is that the world needs more pelvic health advocates, educators, and clinicians. The world needs you. We really, really, really do. In whatever capacity you want to join our mission and join our movement. Talking to your friends and family about pelvic health issues, asking your friends who may have just had babies, like, hey, how are you feeling? How are you really feeling? And then maybe connecting them with help if they need help. I mean, that's changing the world. It truly is. So what are some action steps? As I mentioned, I give this presentation at universities all across the country. I've actually been in California quite a few times virtually teaching. So if you like this presentation and I have not yet been to your university, invite me and you can get your college or university or your pre-PT club or your pre-OT club or your special interest group, you can get it on the map. If you're interested in doing that, you can find me, you can send me an email at julia@pelvichealthkickstarters.com. You can find me on Instagram at your pelvic health mentor. Just let me know you're interested and I can take it from there. All right, so remember that special offer at the end? Actually, we'll take a pause here. Just curious because I can talk forever. So if you guys are tracking with me, if you're enjoying this, if you learned a lot, and you're okay if I tell you about that offer, just give me a yes, or drop me a fun emoji, especially if it's an avocado. Grace, yes, please. Cynthia, yes, thank you. Chantal, yay. All right, let's do it. Whoops. All right, so let's talk about that special offer. It's glitching again. We will just go out of the screen share. Oh, that's not what I wanted to do. Coming back. All right, hopefully we can see this. So if you remember this map from the very beginning of the presentation, this map means a lot to me because when I was in your position and I was interested in pelvic health and wanted to learn more, I was searching for a path that would give me access to more education, that would give me access to mentorship, someone to talk to, somewhere where I could explore pelvic health and see if it was something I was interested in, see what it was about. And I was really interested in finding a path because for most of my life, I've been a student. And when you're a student, the path is laid out for you. You know, when you're in school, it's like, all right, everything's broken down into semesters. It's, you know, take these classes, pass these tests. And then on the other side of graduation, you get everything you've ever desired. And I was like, yeah, I'm used to having a path. Cool. Where's the path for pelvic health? And one did not exist. There are 2 specialty tracks within pelvic health. So one is hosted by the APTA and one is hosted by Herman and Wallace. So if you're interested in adding some letters after your name, these are the 2 tracks to get there. You could also do a residency program. So basically the way these 2 tracks work are you take a number of courses, then you get 2,000 hours of one-on-one patient care with pelvic health clients, you record them, and then your reward at the end is that you get to sit for a 3-hour exam, and then you get some letters after your name. So that is cool if that's something you're interested in. But other than that, there was no path, just to learn more. Like I just wanted to know if I was interested. So if you are in the same boat, this was created for you. It absolutely was. And you can kind of see like where we are on the map. So congratulations, y'all just completed maybe your first masterclass. Yay. So you're like, all right, cool. This was fun. I want to learn more. Where do I go? Well, the next stop along the path is the Pelvic Health Kickstarter Academy. And I just want to share with you a little bit about it because it's something I'm super passionate about. And if you're looking for a path in pelvic health, this is an amazing option. And of course, I'm a little biased, but you know, it's my baby. Other things I'll just point out on this map, I do have a shadowing and clinical internship directory. So this was actually born last year during the throes of COVID, talking with so many students who are like, hey, I'm looking for shadowing hours to apply for PT school. And I would like to have some pelvic health, but I can't find any. Like all the clinics are, you know, not allowing students because of COVID or shut down, or hospitals aren't allowing me to come in and observe. So reached out to a bunch of pelvic health PTs who I was in contact with who were complete rock stars in the field. And I was like, hey, students need our help. What can we do to help? Like, can we offer virtual shadowing experiences? Can the students join us on Zoom and see how we do things? And they were like, yes, yes, yes. So if you're interested in doing in-person shadowing, virtual shadowing, or even doing a clinical internship, there is a list. It's actually connected with the Academy. So if you're interested in that, you can find it through the Academy. For anyone who graduates from the Pelvic Health Kickstarter Academy, you are eligible for one-on-one coaching with me. So I coach students. I have about 7 right now. I usually only take 4, but I have a hard time saying no. If someone's really passionate and really wants to pursue their dreams, I don't want them to wait any longer. So I have 7 coaching students right now that I work one-on-one with. Some of them I'm coaching for clinical expertise and clinical decision-making. So we're going through patient cases, patients that they have in their clinic. Many of them are in their first jobs or on clinical rotations, and they're seeing patients for the first time. I also do business coaching. So if you have any desire to be a PT who owns their own business, whether it is a physical practice or an online business, and you need some help and support, I love doing that. At the end of this month, we're actually finally releasing the Pelvic Health Kickstarter's Practice Igniter. So if you are interested in starting your own practice, one of the things that's going to be super important for you is marketing. So you can be the best PT in the world, but if if the people that you love to serve do not know that you exist and can serve them, then it means absolutely nothing. That's why marketing is so important. So teamed up with 17 experts in the field of social media and online marketing to help put out this course. So everything from designing a website to doing Facebook ads, to doing email marketing, marketing on social media, it's all in here. So anyways, Mastermind does not exist yet, but we're working on it. So who's the Pelvic Health Kickstarter Academy for? It is for pre-PTs, PT students, new grad PTs, anyone interested in pelvic health. If you're a pre-PT student, you are not allowed to take pelvic health courses through the APTA and Herman Wallace. They only allow PT students usually in their 3rd year. So if you're a pre-PT student and you want to explore pelvic health, your options are limited. But they're not limited through the Academy. If you're looking to set yourself apart for your PT school applications, this can be a huge asset for you because PT schools are looking for applicants who have set themselves apart in the field, who've garnered a lot of different observation hours, who have shown a commitment to the field of physical therapy and a commitment to exploring it. So this is great for pre-PTs. If you're a PT student and your program does not offer access to pelvic health education, or electives or clinical rotations in pelvic health, and you know you're going to graduate with a gap in your knowledge and skill base, the Academy can fill that gap for you. And you can feel confident graduating from PT school as a holistic provider, understanding where human movement originates from, being a true expert in human movement, being a true PT as the definition is. If you're a new grad PT and you've been practicing and you're like, hey, I feel like something's missing, as I found in my career, this is a really great opportunity for you. Grace, love your comment. You want to be set apart. Perfect. I want that for you too. So what is in the Academy? What's included? So the Academy is 365 days of a deep dive into the amazing world of pelvic health. We used to be a 6-week course, but we're moving into season 5. We've been sold out every single season, and every season we add more and more information. There is an exit survey for everyone who graduates from the Academy. Students put in what they would like to see in the Academy for the next season, and we add it. So it just keeps growing. It's very much student created. It's what they ask for and what they need, which is really cool. So 365 days, we're now a membership site. So it's very go at your own pace. You can move around within the course. It's very interactive. And at the end of 365 days, you get a nice little email from me that says, hey, do you want to stick with us for another 365 days? And you can make a decision on that. So our original 6-week course, our fan favorite course, is housed within the Academy membership site. And within this course, it's pre-recorded videos that will teach you everything about the anatomy and physiology of the pelvic floor. So you'll see a little bit about what we talked about tonight, but a much deeper dive. We also talk about how to do evaluations as a pelvic health PT, how to prescribe exercises like a pelvic health PT, the fun tools that we get to use, everything from pelvic wands and dilator sets to surface EMG and, using their partners. That's important as well. And we also talk about how to find jobs in the field, interviewing strategies, career planning, all that good stuff. It's all in there. One of the things that I think really sets the Academy apart is that there is so much networking. So every month we have 2 live events. One of them is an Academy huddle where everyone from seasons 1 through, at this point, 5 comes, we huddle up and we talk about things that matter. So we might have pelvic health trivia nights, we have happy hours. The one that's coming up, we're going to have a presentation from one of our season 3 graduates who just returned from a medical mission trip. And she's going to tell us how we could get involved, which is really cool. I'm all for that. We also have a guest speaker that comes in every month. And these guest speakers are from all across the globe. They are rock stars in pelvic health PT. Last month, we welcomed in Anne Munyao, who is one of only 20 pelvic health PTs in the entire country of Kenya. And she talked about how pelvic health has drastically transformed her country and her community. The month before that, we invited in Bill Taylor, who is an internationally renowned pelvic health speaker. He was actually the very first pelvic health physio in Scotland, which is phenomenal. He teaches in Reykjavik, Iceland, in London, England, and he was so gracious to teach us in the Academy. He taught us all about sexual dysfunction, such as erectile dysfunction and hard flaccid syndrome. So some male pelvic health stuff, which was super interesting and incredibly fun. You also get access to one-on-one mentorship. This is huge. It's incredibly hard to find mentorship in pelvic health because there aren't a lot of pelvic health PTs, and those of us who are in pelvic health, we're pretty busy. We're trying to save the world, you know? So if you're looking for one-on-one mentorship for your journey, you can find it here. And I would love to partner with you and provide that mentorship. So you get that with me if you want to hang out some more. And you also get access to our pelvic health shadowing and internship directory. There's a whole lot more offered. Free t-shirt. You actually have like 5 to choose from. We have our own t-shirt shop. You could choose this one if you want. This one's very cool. It's very soft. I love all of our new shirts. I have some more right here. They're all great. I mentioned our Academy huddles, our one-on-one power calls, which are our mentorship calls. We have a pelvic health Kickstarters community that you can join and be a part of. We talk about case studies. Experts are constantly coming in and sharing their wisdom and knowledge with us. We have an article research library where you can find all the research that is pelvic health related. It's crowdsourced, so it's constantly being added to. And you can have access to the Academy for life. So it's 365 days with a little email after that asking you if you want to stay with us for another year. So the Academy can grow as you grow. And of course, tons of surprises, special opportunities along the way. This is one of our t-shirts if you're into it. We also have a bunch of others, but join the Academy, join the movement, and spread the word. You can do that with a t-shirt. It's amazing the power of a t-shirt. So what does the Academy cost? So there are 2 pathways to choose from to find the best fit for your journey. So the 2 pathways are the Discovery Package and the World Changer Package. The way I describe these 2, if you're just like, pelvic health, just heard about it, I kind of want to dip my toes in, Discovery Package is perfect for you. If you're like, pelvic health, I want to like get face down in that Kool-Aid, I want to change the world, then the World Changer Package is for you. So you can see the prices here. These are the season 5 prices, but I told you I was going to offer y'all a special offer because I love to reward proactiveness. I love to reward people who invest in themselves, because when you invest in yourself, you invest in the future of our world. And I support that fully. So my special gift to you is that we are in season 5, but I am fully prepared to offer you season 4 prices for the Pelvic Health Kickstarter Academy. So that means $100 off of the Discovery Package and $200 off of the World Changer Package. And if you're interested in learning what is included in all of these packages, you can go to www.pelvichealthkickstarters.com. You can click on the Pelvic Health Kickstarter Academy icon right there, and it will take you to this little page where you can learn all about it. If you are not tired of hearing me talk, you can click on the video and hear me talk some more. You can scroll down and you can see everything that is included in these two packages. So there is a lot, and there is a ton included in the World Changer package. So you can go through that and pick something, pick a path that is best for you. There's also payment plans for each of these packages. So I can do a one-time payment. I can break it down for you in 3 months, 6 months, or 12 months. So it's very affordable, and you can see everything that's included. Here's the fun little workbook. You can see some of the pages included in the workbook, and you can read through a lot of testimonials from our students from seasons 1 through 4. So maybe you will resonate with some of their journeys. There is a 100% money back guarantee. So after 3 weeks of being in the academy, if you're like, this is the worst decision of my life, no one has ever said that. But if that's how you feel, I will give you all your money back. There will be questions because I want to make sure that, you know, the academy is literally the best thing out there, and I want to make sure that it improves. So I will ask you some questions, but you will get your money back. Fun fact, this is my mother. My mom is a season 1 grad of the Pelvic Health Kickstart Academy. She was a PT for 35 years, and this is my brother and my dad. So my mom loved the course. If my mom loved it, I'm sure you'll love it too. She's biased, of course. But anyway, so you can check this out. This map looks familiar. So I will drop the link for this in the chat. I would encourage you all, if you're interested, just go ahead and copy this link or go ahead and click on it, open it up in a new browser so that you have it and you can explore it later. Yeah, cool. All right, so I mentioned that season 5 launches September 6th. So September 6th is when the prices are going to go up. So if you are interested in getting season 5 prices, getting your $100 off of the Discovery package or your $200 off of the World Changer package, let me know before September 6th, and I will set you up with that. I also want to mention that usually there is an application process for the academy. We do not take everyone. We only take people who are interested in changing the world. So I want to align with people who are aligned with my mission and vision. So we don't take just anyone. So there is an application process, but because you signed up for this masterclass, I already know that you're investing in yourself. So I'm going to just like nix the application. No need for that. Instead, if you're interested in being a part of the academy and want to discover whether it is a good step, like the perfect next step for you in your journey to set you up for success, all that you got to do is set up a discovery call with me. I'm going to give you my Calendly link to do that. You just click on the link, you find a day and time that works for you, and we can talk about it. During that conversation, I'm going to ask you questions about, you know, your dreams and your hopes and your goals and what you want to do in the future, what sort of impact you want to have, who you're passionate about serving. And together we can figure out whether the academy is the next best step for you in your journey. We can figure out a pathway, we can figure out a payment plan, and I'll get you all set up with that. So I'm going to go ahead and copy my Calendly link right now, and I'll just put it in the chat. So go ahead and copy that. I'll also put it in the email that you're going to get tomorrow with the replay. So it's okay if you don't snag the link now. But yes, so join us in the academy. I would love to have you. Come get the season 4 prices. Do yourself a service here. Don't wait till the prices go up. But anyways, thank you so much for letting me talk about pelvic health. It's my favorite thing to do, and I love doing it with you. So would love to meet you all and chat with you. Let's stay connected. So well, no one joining live is from Pennsylvania. I was going to be like, just stop by. My door is always open. You're welcome to fly here from California. That's cool. But you can also connect with me online. So we have a free Facebook group. As I mentioned, I go live in that group every Wednesday night. So if you'd like to join our Facebook group, hop on your phone right now and just type in Pelvic Health Kickstarters. We're there. Come join us and connect with me on Instagram. Connect with me on the gram at Your Pelvic Health Mentor. And feel free to DM me if you are interested in the Academy or interested in another masterclass, or want to connect with pelvic health PTs in your area. Let me know. Any way that I can support you in your journey, I would absolutely love to do so. So get at me. I'm just going to check the chat real quick. Yeah, Grace, you're on top of this. Connected on Facebook and Insta now. Yeah, perfect. Glad to be friends. Yeah, so I'm going to go ahead and stop the screen share here. And I'm also going to end this recording. Those of you who are joining live, feel free to stay on. And if you have any questions, I would love to answer them right here, right now. Or you can always get me on Instagram. But for those of you joining on the replay, thank you so much. It has been fun. I love meeting with you in any way possible. So virtually, replay, whatever, it's all good for me. So if you have any questions, the links are in your email, so you can click on those or find me on the gram or go to our website, www.pelvichealthkickstarters.com. Would love to see you there. Thank you and good night.